A bill that would test some babies for a virus that causes hearing loss is currently on Governor Ron DeSantis' desk. Fox 35's Christy Kern spoke with the doctor about it and a family impacted by the CMV virus.
Do you like your Elsa shirt?
Yes, Elsa.
3-year-old Maddie is doing well now, hearing and talking.
Rachel wants to be.
But it wasn't always this way. She was born with moderate to severe hearing loss that got progressively worse, and doctors didn't know why.
There were so many unknowns that it was almost impossible to not be filled with fear or anxiety.
Her parents spent months trying to find out the cause. Then her pediatric ENT, Dr. Cedric Pritchett of Nemours Children's Hospital, had an idea.
And it happened that we were able to detect CMV and the heel stick blood sample that was kept for her.
Maddie had congenital cytomegalovirus, or CMV. It's a fairly common virus, but can cause developmental issues for babies who contract it in the womb, including hearing loss.
I think the biggest fear was that her hearing loss would cause some sort of isolation, and hearing loss should never, ever equal isolation.
Maddie is not alone in her diagnosis. According to doctors at Nemours Children's Hospital, CMV is the most common cause of permanent non-genetic hearing loss for children, and approximately 5 in 1,000 babies are born with CMV in the state of Florida.
Almost twice the rate of our hearing loss.
Dr. Pritchett spoke in support of a bill that would make it so all babies who fail a newborn hearing screening are immediately tested for CMV. It would allow for early detection, which is key for early intervention, including antiviral medication, therapy, and possible hearing aids or cochlear implants.
We can provide some expectation for his family. We can tell them what to look out for. We can make sure he's involved in services early.
Luckily, Maddie was a candidate for cochlear implants and got them when she was 1.5 years old. Her mom said she's made massive progress since then. She's done almost 3 years of work on her hearing in just the past year.
Just today, I called her from across the house, and she was able to respond to me, understand what I was saying, and listen and obey what I had asked her to do. And that was seriously unheard of, before she was implanted.
Christy Kern, Fox 35 News.